And thank you for joining us today. So I'm going to do a little bit of an introduction of you first for all of the rest of our participants. So Dr. Feham Riaz is a dentist and she is also a digital health professional. She is a Chevening scholar. She did her master's from the UCL Global Business School for Health, and she has been working on a lot of different digital health initiatives. And so today, that is what her lecture is going to be about, along with different guidelines for how to apply for the Chevening Scholarship. And yeah, over to you, Dr. Fahim.
Thank you. That was quite an elaborate introduction. So I'm very happy to be here, you guys. And I wouldn't call this like an entirely a lecture. I think it'll be more of like an interactive conversation. So I'd love to hear your thoughts at the end of it. And if you guys have any questions, please do keep popping them in the messages, and we'll go over them at the end. So I'll just share my screen with you guys. One second. Let me know when you can see it. Can you guys see my screen?
Yes, we can see it.
All right. So this is a little bit about myself. So I am a dentist, surprise, and I'm a digital health professional. So I graduated from Foundation University College of Dentistry. After that, I did my house job from Project Foundation Hospital here in Islamabad. And then later on, I worked with a health startup that was working with a client in America. So I worked on a telehealth project there where I got familiar with a lot of the HIPAA laws. That's the healthcare law for the US. And I became more familiar with the technology they used. That's where an interest for health technology kind of took momentum. I was already really passionate about it in school. From there, I went on to become a demonstrator at Margolis Institute of Health Sciences. I was there for a good bit of like 8 months, and then I went to do my master's at Global Business School for Health, which it happens to be like the world's first business school for health at University College London. So I studied digital health and entrepreneurship from there, and I was very lucky to be a Chevening Awardee. And after that, I came back. Before coming back, I was working with a health startup in the UK where we worked on an AI-based tool that predicted relapse and psychosis. And we did our research at Yale University. And then I came back home, and here I'm currently working at Shifa International Hospital. I'm the digital informatics specialist. So I'm really passionate about co-creating solutions, and I have a very user-centered approach. I'm not like a technology first sort of person. So to get on with it, I'm going to start up talking about Chevening because I think everybody's really interested in that. And then we'll go on to talk a bit about what I do, what parts of digital health do I work with, and more specifically, the hot topic, which is AI. So just to know a little about Chevening, it's the UK's fully funded scholarship, and the applications open next month. So if anybody is looking to apply, now's the right time to get started on your application. So it's funded by the Foreign Commonwealth and Development Office, the FCDO, which was previously referred to as UK Aid. It is no longer referred to it that way. We now call it FCDO. And they identify individuals from around the world, Commonwealth countries, where they identify individuals who have leadership potential, and they give them opportunity to study in the UK. So what does the Chevening Scholarship cover? It's a fully funded scholarship. इसमें सब कुछ आ जाता है, आपकी tuition fees से लेके आपके living stipend तक. So if we break it down, your tuition fee is fully covered, and then your travel is fully covered. And then जो वीजा की एप्लीकेशन फी होती है वो भी कवर्ड होती है, डिपार्चर अलाउंस मिलता है आपको, एंड once you arrive in the UK you get an arrival allowance, and monthly आपको living expense एक stipend दिया जाता है to live in the UK. It goes on for a span of 12 months, जितनी आपका education period होता है. अगर आपका program earlier खत्म होगा तो आपका stipend भी फिर earlier खत्म होगा. Can you guys see my screen? Hello? Is my screen changing वैसे?
Yes, we can see your screen. Is it? Are you still on page number 2 or 1?
No, I'm actually ahead.
Yeah, but आपकी ना screen is at page 1 पे.
Let me try again. I don't know why that happened. Okay, let me know अगर वो आगे पीछे नहीं होती ना. So ये page 2 सबको नजर आ
Yes,
रहा है?
yes, we can see. Yeah,
Already
the
been
pages are
on.
moving now.
Okay, perfect.
Yeah, it's perfectly working now.
Okay, I'm sorry you guys had to see that intro for a very long while. Okay, so this is what the Chevening covers. This is what I went through it. And if at any time my screen just stops working, just give me a shout. तो एलिजिबिलिटी क्राइटेरिया इसका क्या होता है? बेसिकली आपने अचीवनिंग एलिजिबल कंट्री से अप्लाई करना होता है, विच आर कॉमनवेल्थ कंट्रीज, एंड इट्स इंटरेस्टिंग दैट कनाडा इज आल्सो वन. जो आपकी अंडर ग्रेजुएट डिग्री कंप्लीट होनी चाहिए. अचीवनिंग की एक तो स्कॉलरशिप होती है और फेलोशिप होती है. सो जो फेलोशिप्स हैं वो बहुत स्पेसिफिकली हैं, जर्नलिज्म में है, इस्लामिक स्टडीज़ में है, सो दैट्स समथिंग यूड हैव टू एक्सप्लोर. जो मास्टर्स है, अंडर ग्रेड की स्कॉलरशिप नहीं होती, सिर्फ मास्टर्स की स्कॉलरशिप होगी. So you need to complete an undergraduate degree, and it needs to be equivalent to like an upper second class honors. जो UK में system होता है degree evaluation का, या तो आपकी upper first class honors होती है, या तो आपकी upper second class honors होती है, which is like 2-1. You need to have at least 2 years of work experience. We'll talk about this in depth. And you need to apply to 3 different universities in the UK. And by the time, if you get the scholarship, you need to have an acceptance from these universities by 15 July. So this is like 2024 is going to go here. Okay. So then we have work experience. Can you guys see my screen? Okay. So a work experience, this is an area where everyone gets like really confused कि work experience मेरा full time नहीं है, मैंने अभी graduate किया है, मैं क्या करूँ? अब work experience जो है ना, ये काफी it's very diverse. It can be full-time employment, it can be part-time employment, it can be voluntary experience, आपकी paid या unpaid internships हो सकती हैं. As health professionals, अगर हमने MBBS या BDS किया है, तो आपकी house job जो होती है वो एक 1 year का experience तो है आपके पास full-fledged. उसके अलावा अगर आपने कोई internship किया है, कोई volunteer experience है, कुछ भी है, वो भी count होता है. It doesn't have to be like a full-time experience, full-time employment everywhere. इसके लिए अचीवनिंग की रिक्वायरमेंट है कि आपको 2 years का वर्क एक्सपीरियंस चाहिए. अब ये कुछ भी हो सकता है, लाइक द थिंग्स दैट आई हैव मेंशन, इनमें से कुछ भी हो सकता है. और जो वर्क एक्सपीरियंस है, दैट्स ब्रोकन डाउन इनटू 2800 आवर्स. अब ये ऑटोमेटिकली कैलकुलेट होता है. जो अचीवनिंग का पोर्टल है उसके अंदर इफ़ यू ऐड लाइक अपना वर्क एक्सपीरियंस आप डालते हो कि मैंने जनवरी टू अगस्त इस जगह पे काम किया है और मैं मंडे टू सैटरडे काम करता था और मेरे वर्क आवर्स थे फॉर एग्जांपल 9 to 5 या 9 to 2, तो वो ऑटोमेटिकली कैलकुलेट करता है आपके आवर्स. सो दिस इज नॉट समथिंग दैट यू हैव टू लाइक कैलकुलेट योरसेल्फ. इट्स द पोर्टल इज गोना डू इट ऑटोमेटिकली फॉर यू. तो if you I strongly recommend if you're a fresh grad to pick up some voluntary work. There's so many organizations that are always recruiting, so this is a really good way to get ahead with your scholarships. Chevening ka jo portal hai, it's the website, it's like pretty amazing. If you just go on to it and you search what program you're interested in, kaun se course aapne dekhna hai. For example, maine idhar endodontics डाला है, तो नीचे पूरी लिस्ट आ जाती है कौन कौन से एलिजिबल प्रोग्राम्स हैं. सो आई वुड स्ट्रांगली recommend कि इससे थोड़ा सा एक्सपेरिमेंट करें and explore करें, like just type down health, write about sports health if that's something you're passionate about. I do want to mention कि जो clinical subjects होते हैं उनमें scholarship नहीं मिलती. It's mostly जो basic sciences के होते हैं या non-clinical areas जो होते हैं उनमें आप masters कर सकते हैं. For example, जैसे ये endodontics का it's clinical aspect के it's unlikely कि ये cover करेगा. This is just a list of different courses that you can look at. There's dental materials के हैं, oral surgery के भी हैं. One thing that people find really interesting is forensic dentistry. Then there's minimally invasive dentistry, conservative dentistry. If you go on towards a more public health side of things, so public health hai, global health hai, there's digital health, and then there's also health policy, public policy, health data science. So there are a lot of things that you can explore on the Chevening website. Chevening के लिए we need 2 references, and these are references जो portal पे आप खुद upload करते हैं. So they need to be like in English, they need to be uploaded by the candidate themselves. और दूसरा ये होता है कि it needs to be addressed to the British High Commission. When you're working, I would strongly recommend if during your house job you have a professor that you really look up to, so I would recommend कि उनसे, rather than waiting for your house job to end, just get like reference letters by all of the people that you have good terms with. And there's a lot of trend in Pakistan when you ask your professor or a superior for references, they usually say, "Acha, just type it down and I'll just sign it." So I think that gives you a little advantage कि जिस तरह का आपको चाहिए आप थोड़ा सा उसको उस तरह maneuver कर सकते हो. Of course, at the end of the day, if your professor is okay with that. But ये एक फायदा होता है कि आपने अपलोड खुद ही करना है. आपका जो प्रोफेसर, sometimes a lot of our professor may not be that tech savvy, तो वो इतना प्रेफर नहीं करते कि वो खुद अपलोड करें. So इसमें एक ये एडवांटेज है कि you upload it yourself. Chevening के लिए you have to write 4 essays. इसकी basis पे you get selected for the interviews, और फिर आपके interviews होते हैं. Interviews की basis पे you get awarded the scholarship. So this, like, if you start now, you start writing your essays, it's gonna take like November में deadline होती है. Usually ये थोड़ा सा vary करता है. November 1st was my deadline, but now it's a little ahead. I believe it's 6th November this time around. So if you start now, November में आप अपने essay submit करते हो. फिर मार्च तक जाके आपको पता चलता है कि you've been selected for an interview. मार्च में interviews होना शुरू हो जाते हैं. If your interview आप successful होते हो तो फिर by July you find out that you got the scholarship or not. So almost एक पूरा साल ही लग जाता है इस process में. जो essays होते हैं वो 4 essays लिखने होते हैं chevening के लिए. That's leadership पे होता है एक network building and shared learning पे, एक studying in the UK पे होता है और एक career plan पे होता है. We'll go ahead and like talk about these further because I believe this is a very important area. तो अब जो leadership वाला ऐसे होता है उसमें you have to talk about leadership traits. Now, we often start with like a nice fancy quote. So you don't have to do that. Don't start off with a quote. Write about what leadership means to you. And it's like, if it's the more personalized it is, the more authentic it is, that's a good essay, like something that I want to read. So don't be very academic about it. Okay, leadership means this in the dictionary. Or some guy said that leadership should be like this. What is it to you? Or leadership के बहुत से different styles होते हैं. So maybe you have like a collaborative leadership style जो आपने over the past showcase भी किया है, demonstrate किया है, उसको अपनी examples में बताएं. Or you could talk about like really what is it to you? It's just, it's not just a buzzword. So then you have like networking and shared learning. So this just goes beyond just making connections. It's like meaningful networking. Okay, networking se fayda kya hua or kisko hua. At the end of the day, it shouldn't be just about like, I was I networked and I got this job, then I got promoted because I networked again. So it has to have like a, a bigger impact. Like, what did networking do for your community? That I collaborated with this person, it helped my organization do this for this community. Like, that's sort of like a meaningful networking. और इसका पर्पस ये होता है कि Chevening जो है ना, it's a very diverse community. You have people from all over the world, and you need to be able to connect with them. So you have to show that I'm all about networking and shared learning. फिर जो आपका third essay होता है, that's about studying in the UK. So everyone has a different approach to it. What I did was that मेरा first paragraph था why I want to study in the UK really. Like, what is it that drives you? You could study anywhere in the world. Why would you want to study in the UK? That's also a question. Like, if you're selected for the interviews, they often ask you that, like, okay, why not USA? Why UK? So you have to be really prepared for that, to answer that. Is it the history that draws you towards the UK? Is it the diversity? So you have to talk about those things. For my essays, succeeding paragraphs, I talked about, like, first I talked about my first university, my first preference, which was University College London. Like, why do I want to go to UCL? Second university, I picked Strathclyde. Third university, I picked Bristol. So individually, आप उन universities के बारे में लिखें. And, just go beyond just the surface. Like, don't just write about इसकी academic ranking जो है ये दुनिया की top 100 universities में आती है. ये subject जो है ये top 50 में आता है. So go beyond that. Maybe talk about जो इस university की policies हैं. For example, this university is working really hard to reduce the carbon footprint, and that is something I'm very passionate about. So I want to study here. Or talk about diversity. Okay, this is one of the most diverse universities in the world, and I want to meet people from all around the world. So talk about, like, go in depth. Talk about bigger things, talk about professors. There's a lot of information that's available on universities की websites जो होती हैं. उसमें अगर आप program निकालें, उसके modules देखें, उनके modules को ना थोड़ा सा in depth देखें, and then even जो reading list दी हुई होती है वो भी available होती है बाज़ दफ़ा universities की. So see कि ये लोग पढ़ाते क्या हैं उसमें, and then, like, be very specific about the things कि I really want to learn from this professor, or this professor has done research in this topic which I'm very passionate about. So, go beyond just the surface, go in depth be very specific about what you want from this program. There are a lot of programs, internships karate hain, where they take their students abroad. So that's something people are really interested in. I had a lot of friends who went to Ghana, they went to Kenya. So you could talk about those things. That's something they were really passionate about. उसके बाद जो last paragraph होता है, last essay होता है, which is also considered as one of the most important ones. I think they're all important, but there's a lot of reason that people believe that this is the most important essay, because iski basis पे, they kind of see, okay, what do you envision yourself as? So the last essay is career plan. इसमें अब essay writing की ना कुछ different approaches होती हैं, कुछ different techniques होती हैं, which we're going to talk about. So इसमें ना you have to write about your short-term goals, your middle-term goals, and your long-term goals. We'll go in depth about that later on. A very important thing to mention in your essays is how you're going to create an impact. So you create an impact by contributing to sustainable development goals. As health professionals, we mostly fall under the good health and well-being category, but you have to be very specific how you're contributing to that goal. A really good resource would be checking out DFID, जो UK का department है, जो different parts of the world में different initiatives करता है. So you can say, I'm interested in this initiative जो DFID का है, and in my plan, my middle term goal is that कि मैं इनके साथ वापस आके यहाँ पे काम करूँ. So कुछ qualities होती हैं that Chevening looks for in their potential cohort. One of them is like a determined leader. A lot of Chevening scholars go on to assume very senior positions. There are presidents around the world who've been Chevening scholars. बहुत senior judicial system में positions and that are taken up by Chevening scholars. Government officials बहुत senior होते हैं, so they're always looking for somebody who knows what they want, has a clear idea of how they're going to help their country. So you have to showcase yourself as a very determined leader. And then you have to be original. You have to be authentic. Don't like chat GPT it. Like everyone has their own experiences. And I think authenticity and originality always shines through. And, you know, it's just your story is so individual कि वो कोई और कहीं पे कॉपी नहीं हो सकती, किसी से similar नहीं होगी. So that's where you have an edge. So tell your story. And be very mindful of plagiarism, even when you're now that of chat gpt I guess, so when you're copying stuff from chat gpt, that still counts as plagiarism because you didn't write it, you took it from somewhere. So be very mindful if you're taking some reference भी अगर आप कुछ कर रहे हैं ना कि for example इस article में ये लिखा हुआ है तो उसको भी reference करें, उसे cite करें, like and rephrase it. Be very mindful of plagiarism because that's like a pretty big offense. And then they want to see someone who has growth potential. So when you move to the UK, a lot of people get very depressed because you're going to a new country. So you need to be somebody who can adapt in a completely different environment, completely different culture away from home. उसके अलावा आपके interpersonal skills भी बहुत ज़्यादा grow करते हैं. So they want somebody who's willing to adapt to different environments. The last thing is like the structure and grammar. A lot of people usually reach out to me to review their essays, and one of the things that really like puts me off is when like the structure or the grammar is like really off. You know, if you're writing your essay, if you want it to be like something that somebody else is going to read, and remember that these people are reading so many essays, so you have to catch their attention. If they're going to see iska structure off hai, like aapne ek bahut bada paragraph likha, phir aapne ek bahut chota paragraph likha, phir aapne ek bahut bada like it shouldn't be like that. It has to have consistency, or grammar jo hai wo theek honi chahiye. So use tools like Grammarly to check कि कहीं पे कोई error तो नहीं है, कोई कहीं पे you missed out punctuation, कहीं पे capitalize तो नहीं करना था. It just, when you're reading it as a reader, when you're first time reading it, you kind of get distracted when you see like a structure or a grammar error. Then you're like, आप थोड़ा सा content से ना offset okay, you're like, अच्छा इसने तो बहुत ज़्यादा errors किए हैं. All of a sudden आपकी जो attention है ना वो content पे नहीं रहती. So be very mindful that you don't make any grammar mistakes. And to be very honest, वो इतनी ज़्यादा like कभी कभार छोटी mistakes हो जाती हैं कि even while I was submitting my application, उससे 2 minute पहले भी मैंने changes कर दिए थे, which is like ridiculous. So you never know. Just be very mindful of this. अब कुछ approach and that you use these, and even जब हम interviews दे रहे होते हैं, these come in very handy. तो इसमें होता है कुछ चीज को explain करते वक्त ना हम situation describe करें, फिर task क्या था, action क्या किया हमने, और उसका result क्या हुआ. इससे ये होता है कि जो impact होता है ना वो बहुत अच्छे तरीके से लिखा हुआ demonstrate हो जाता है, like in a literal sense. So it's always better to use these जब भी आप अपनी leadership की examples दे रहे हैं, अपनी networking की examples दे रहे हैं. Career plan के लिए हम use करते हैं the SMART approach. We'll discuss this in depth later on. SMART stands for कि आप जो भी define कर रहे हैं वो specific होना चाहिए, measurable होना चाहिए, attainable होना चाहिए, relevant and time bound. I'll share some examples later on. It'll give a better idea. Just for example, if we talk about specific, now we all want, world hunger to end, but just saying that I want to contribute, I want to end world hunger, that's like it's a very broad statement. You can always rephrase it differently and show impact and quantify wherever it's required. So instead of saying I want to end world hunger, you can just write it differently, like I want to contribute to hunger reduction by engaging in rural extension or development, by financing or input acquisition. So this is just like a hypothetical situation, but just saying this is more specific. Like आप कैसे करोगे, आप आपके विजन क्या है इसके लिए, ठीक है, और इसके आगे आप उसको चीज़ों को क्वांटिफाई भी करोगे टू इंक्रीज फार्मर आउटपुट्स एज फार्मर्स कॉन्स्टिट्यूट लाइक एन एक्स परसेंटेज ऑफ whatever nation community etc. You always need to quantify. इससे ये होगा कि आपने सिर्फ इम्पैक्ट बताया नहीं है कि इम्पैक्ट क्या होगा, आपने ये भी बताया कि कितना होगा, आपने क्वांटिफाई कर दिया उसको, which is like a instantly you you're interested okay, okay, yeah, this person knows what they want to do. And I would invest like immediately, okay, this person has an idea, they have a plan. When you just make a vague statement, it's difficult for the reader to gauge how invested you are in this. The second thing we discuss is it needs to be measurable. So your goal, how is your goal going to be like measurable? So again, you need to like quantify. So I put in an example here that by just, these are all hypothetical. So with my background in production of wheat plus my master's that I'm going to do in sustainable agriculture, upon returning, these skills can help me impart the knowledge to increase farmer output of wheat from the current level to like 100 times larger compared to our economy, to this more developed economy. So you just gave a lot of very broad, like a very solid example. And then you can also कोई article पढ़ के you can reference it. और कहीं से अगर आप stats उठाते हो ना कि इस year हमारी mortality rate इतना था, इस साल इतना था, it's always better to cite it where you're picking up that information from. Then they need to be like attainable and realistic. So you have to be very specific on how you're going to attain these goals. You could either be a part of an organization that's already working towards that goal. So you can say, I want to become a part of this organization, and at this position, by networking with these people, I'm going to contribute to this. Or you can say, I'm going to work in my community to do this. So you have to be very specific and realistic about how you're going to achieve that. Moreover, it needs to be time bound, your goal. So like an example here is that if you want to work as an art director, in 1 month you're going to find a graphic designer to intern with so you can learn. In 6 months you're going to graduate from university. In 1 year you're going to land your first gig. In 5 years you want to get hired as an art director. So इसमें आपने एक timeline define कर दिया कि मैं यहाँ से start करूँगा, फिर मैं ये करूँगा, फिर मैं ये करूँगा. So it's all, then it seems reasonable. If you're just gonna say, I wanna, I just wanna eradicate this disease from the face of the earth, and how you're gonna do that, it's very difficult. So you have to be very specific, and you need to follow like the SMART approach. It serves as like sort of a framework that guides you in writing a more plausible essay. Now, a lot of people ask me that, well, I just completed university. I don't meet the requirements. What do I do? So, first of all, I would say just start getting any kind of experience. It could be an internship. If you're in med school right now, I would say start working voluntarily. Voluntary experience goes a long way. So I started working at Honehar, which is a student-run NGO for education. And I had like 4 years of experience already by the time I was applying for my Chevening application. I had like lots of experience going on, which exceeded the minimum requirement. So it's always amazing to have some voluntary experience, and it gives you an opportunity to give back to the community. Have a vision and start networking. I strongly advise young professionals to have a strong LinkedIn profile, get on it early. And a lot of times after your professional network, it also becomes your personal network, and these colleagues become friends. So, and that opens up a lot of opportunities for you. So really invest in your network and get involved in community activities. And जो Chevening की website है ना, उस पे बहुत ज़्यादा resources available हैं. I think it's a very underrated resource. Just check out the website. उसमें blogs भी हैं. As scholars, now I'm not a scholar anymore. Like as a past scholar, they reach out to us, like give us your as an alum, give us your advice. Ke, what do you want people to know? So many people give their advice. There's so many blogs. Ke, what not to write in your essays, what to write, what errors to be mindful of. So जो Chevening की website है ना वो that's like an amazing resource to start with. There's सब कुछ मिल जाता है. Like anything you're looking for, it's already on their website. So definitely check that out. Um, okay, so a little bit about myself. So like I said, I'm the digital informatics specialist at Shifa International Hospital. So a lot of work I do is with like data and AI. And often when I say, okay, so I, I check out AI and I just say that very randomly. And then people think, oh, this is what like she means, this is what AI is in healthcare. It's like a robot reading scans, when actually it's like much different. It's like the applications of AI are like so specific and often not as cool. Sometimes really cool, but more times it's not really cool. It's a lot of work. So a real example is the one written below that this AI startup is trying to make fax machines work better for healthcare. So that's not as glamorous, is it? So you would think, but companies really marketed that this year be AI. That makes like absolutely no sense. But we'll talk in depth about like what AI, the applications of AI in healthcare really are. So um it's very broad, and at the same time they're also very like specific applications. एक population level से अगर हम बात करें एक individual level तक, there's a lot of work going on, but generally we're still working towards achieving that golden spot where we can say, oh yeah, we're confident, yeah, like yeah, fit scene ho gaya. Wo, abhi tak we haven't really reached that. There are very specific cases where we're like, okay, yeah, this AI works best here. But most of the places, it's a lot of research. It's अभी तक वो अपने बहुत ज्यादा ना research phase में है. We're still trying to develop better and better. We can't say for sure, yeah, this is it. So some of the applications I want to discuss are like it could be for patient care, physicians, medical imaging. Imaging ke baare mein to a lot of you must have heard that AI is going to replace doctors. I mean radiologists, and that's not going to happen anytime soon. Trust me. And then there's a lot of research and development where AI plays a massive role. So one of the areas that I particularly work in is like data mining and analytics, and I feel like AI has a lot of potential in extracting insights from data. That's like, I think AI would be a game changer. But again, we're in a lot of research phase. Every time we have a breakthrough, we realize, oh, okay, but breakthrough ke saath saath ek 100 set of problems bhi aa jate hain that we again have to research on. So it's a work in progress, I'd say. Um, just to say a couple of like the cool things that actually AI does. Precision medicine is in an area that a lot of people are interested in. For example, you guys might have heard about 23andMe and Ancestry.com. They take your saliva sample, उससे वो आपके like ancestry बताते हैं. Using the same mechanism, you can also check like how this individual's enzymes work, how their genetic makeup is like. और फिर आप उनको, like all of us are different, right? So आप एक individual के enzyme की working situation के हिसाब से उनको exactly उस pharmacokinetics की medication दे सकते हो. Like अगर मुझे 2 Panadol चाहिए, maybe फातिमा को एक चाहिए होती है. Right, so it's like precision medicine is like pretty amazing. If we go that far, we might just be treating everyone on an individual level, and I think that's pretty amazing. An area where AI plays a massive role, I think, is like I said, data mining. अगर हम hospitals का जो electronic medical records का data है उसको use करके clinical insights extract करें, that's an area that I'm particularly researching on, how we can do that in the best way possible and what kind of insights can help us like on an individual level, on a population level. Dustra, all of the things like written here, it's pretty amazing how AI is like in everywhere. तो अगर हम pregnancy management की बात करें, that's like, that's like a big word. It's like a bit vague, like, okay, how does AI help in pregnancy management? So what specifically AI does is that, if I give you a specific example, there's in some parts of Africa, they're using this mom chatbot है जो local language में AI based chatbot है जो local language में mothers or pregnant females को information दे देता है about any questions that they have. So I think that's a pretty amazing application in a low resource setting, because when we talk about AI, often we're like, okay, maybe it's just going to be in a high resource setting, but it kind of has applications in a lot of places. And there's also recent evidence suggesting that to progress with public health initiatives, we kind of need to incorporate digital health. And this is what they talk about, that technology comes into play here. But like I said, every time we talk about AI, every time we have a breakthrough, we have a lot of challenges. So coming back to the training AI models and data mining, one of the biggest problems in places like Pakistan, and to be honest, the rest of the world, is that there's a lack of regulations. Although around the world there are so many like regulations, and they hinder innovation at times, but I believe that some regulations are still important. At the moment, we don't have any healthcare data laws in Pakistan, which it may be helpful sometimes.
Sorry about that. Please continue, Dr. Feham.
Sorry. So sometimes regulations are important because to एक set of foundation होनी चाहिए कि आप क्या कर सकते हैं क्या नहीं, because when there are no regulations, then there's a lot of exploitation that goes on with data. So we definitely do need some regulations around that in Pakistan. I think AI regulations तो पूरी दुनिया में अभी evolve कर रहे हैं. So to say that they'll come in Pakistan anytime soon, it's a bit of a stretch. But we definitely need to start with healthcare data laws to empower our patients and to start working with healthcare data. दूसरा, lack of infrastructure. We don't have a lot of clinicians trained to extract data. We don't have a lot of digital health professionals. We don't have institutes that provide that kind of education. And then we don't even have a system that reinforces those initiatives. Like, where is this funding coming from? There are not many initiatives in place that can support that. So we need an infrastructure to drive innovation in this area. And then there are a lot of interoperability issues. Interoperability is like one of my favorite words. I'd love to drop that around every now and then. So interoperability is like, how do you share data between systems? And that is a problem all over the world. How do we safely, effectively share data between two parties? So that is an issue that all over the world we're trying to solve, and it's a real pain. And it's a topic that, you think machine learning is tough. I mean, if you start reading about interoperability, it's just really mind draining. And then we have a lot of limited resources, especially in terms of personnel. And then there's also limited resources when we talk about institutes. What kind of data do they have? And then there's insufficient data diversity. So if we decide कि हम AI model एक बनाएंगे जिसको हम अपने data पे train करेंगे, अब प्रॉब्लम ये होती है कि जितनी ज़्यादा वेरिएबिलिटी होती है ना, उतनी हर तरह की वेरिएशंस पे आपने अपने एआई मॉडल को ट्रेन करना है. व्हेन आई से वेरिएशन, आई मीन लाइक डिफरेंट इंडिविजुअल्स के डाटा पे. लाइक डिजीजेज मेरे अंदर शायद सेम डिजीज डिफरेंटली मैनिफेस्ट करे, किसी और इंडिविजुअल में वो डिफरेंटली मैनिफेस्ट करे सेम डिजीज. अब ये मोस्टली आती है वेरिएशन, एक तो इंडिविजुअल लेवल पे तो आती है, एक एथनिसिटीज में भी वो वेरी करता है. A lot of our data comes from the research that is done on Caucasians. हम उसको exactly as it is उठा के South Asians पे apply नहीं कर सकते. We're like different people. We are like diseases हम में differently manifest करते हैं. So इसी तरह data diversity हमारे पास इतनी ज़्यादा नहीं है. अगर हम high resource settings की बात करें तो वहाँ पे सारा Caucasian data होता है. अगर हम low resource setting की बात करें like middle income countries जो हैं उनमें जो high resourced institute होगा उसके पास data होगा but वो भी फिर एक certain socio-economic population को target कर रहा है तो फिर एक और divide आ गई तो जो data diversity हमें चाहिए वो हमारे पास available नहीं है. So this requires a lot of like a systemic level पे एक change आए systemic level पे हमारे पास data acquisition हो then we can go on to make more holistic AI enabled solutions. I guess that's about it. And then I am happy to take any questions.
Thank you so much for your session, Dr. Feham. I think पहली दफा मुझे AI in healthcare समझ आया है actually. So thank you for that. You explained it very well. And there has been a question, and number one, I think it's with regards to this Chevening scholarship, and that was, are there any opportunities for the kind, or is there a specific kind of volunteering opportunities that you would recommend when it comes to building our profile for Chevening?
I would say like any kind of volunteer work is welcome when you're applying for Chevening or any scholarship for that matter. Volunteer work is like volunteer work. It doesn't matter what kind of work it was. I can suggest like, so I'm the director of philanthropy at Honehar, and we're always like around the year, we're always recruiting volunteers. So just apply anywhere, to be honest. Professionally speaking, when you apply to organizations that have a more established and robust system, उससे आपको ना काफ़ी चीज़ें सीखने को मिल जाती हैं जैसे as the like I said, I'm the director of philanthropy, so I run the ambassadors team at Honehar. So I ensure that the people on my team get some project management skills out of the volunteer work that they do, because I feel like that's very important going on in their professional lives. It's very important to have those skills. So I ensure that I provide them with necessary resources. So it would be nice to target organizations that have like a robust framework of resources that they provide to their volunteers. But in terms of like किस तरह का volunteer work करना चाहिए, it could be anything. It could be like providing meals. It could be like providing education. It could be like volunteering at the ET Foundation. It could be like really anything at all.
Yes, thank you so much. And I feel like other than just volunteering, it's also about what you take away from that experience and how that adds to you as a professional. And so the next question we have is, how would you recommend we learn languages like Python? And to what extent do you have to work with languages like this in your line of work?
So when I went to do my master's, it was it was basically designed for healthcare professionals, but people from other backgrounds were also welcome. So we weren't taught any hardcore technical skills. We were taught like Figma पे user designing कैसे करनी है, but कोई hardcore coding और इस तरह के skills हमें नहीं सिखाए गए थे, nor were we expected to do that. I have created a chatbot for like psychosis awareness, but that again was like a no-code chatbot. My program specifically was very pro AI. We were always like it was always recommended that you have a tool to do it for you. Why do you want to learn it for yourself? So that was the kind of approach that I've been trained under, and I think that is what I stick to. I don't know any languages, to be honest. Maybe in the future I'd think about learning one, but at the moment I'm doing just fine with the skills and the knowledge I have.
So another question is that what are there any opportunities for students, medical and dental students, or any other students in their undergrad right now who can also start learning similar skills or learning similar programs when it comes to digital healthcare or digital integration?
Yeah, absolutely. I think that would be a really good start to get more familiar with what digital health is, and if that is actually something you want to go forward with. Because I
Mhm.
did have a colleague, she was really passionate about surgery, but she had a lot of like family business in like digital health, so she decided to pursue the degree with us. And like somewhere down the road, she was like, okay, I really miss clinical side of things, and maybe this is not exactly what I wanted to do. So, get a good, like, be familiar with what you want to do. So, I think doing courses on like Coursera would give you a good insight on what this really is. So, there are plenty of courses. There's like an AI course by Stanford, there's a digital health course. I think it's by John Hopkins. I'm not quite sure. But you can do those to get more familiar with like, ye hai kya, or like, kyun hai, or is this something I'm even passionate about? You know, one thing I'd like to mention कि Coursera की जो होती है ना financial aid होती है that you can apply for. You can be like, I'm a student, I don't earn yet, so I don't have the means to pay for this course. तो उससे ये होता है कि वो आपको like a sort of waive off कर देते हैं उसकी fee, and they'd give it to you for free, or like उसको 90% off कर देंगे, so you can pay a small percentage of it, and then you get like a certification उसकी. So that's pretty amazing, and I totally recommend that you do that.
And do you have any tips for calculating community hours or when we're doing our volunteer work? Do you have any suggestions for our participants?
For the Chevening application.
For the shifting application, yes, like how do we calculate our community hours or like, do you have any tips for that?
Like I said, वो ना automatically calculate होता है. You're gonna write like I volunteered from January to August. I did 2 hours each day, the week, Monday to Friday. So वो automatically calculate हो जाएगा उसमें. But I mean, do volunteer work like, out of passion. Don't be very like strict with the like I need to do an exactly like 36 hours or like this much hours. Just like go for it and just do it for a good 6 months or 1 year.
All right, thank you so much. I think that's it for the questions from the audience. Does anyone have any more questions? Please leave them in the chat box. And in case after the session you would like to reach out to Dr. Feham, she is also on LinkedIn. You can definitely connect with her there. And her initiatives, especially Hunehar, is something that's quite popular amongst, I think, Pakistan. I've seen personally a lot of the work that's being done on social media, and we're very, very grateful to you. So if there are any other words of advice you'd like to offer our participants.
I feel like, if you're passionate about digital health, totally like check out what the WHO is doing, what their digital health initiatives are. It'll give you an insight on sort of initiatives that they have for like a high resource setting and a low resource setting. So if that's something you're passionate about, totally check those out. A couple of like if you're into AI, I'd suggest reading up about um, Civil and Mirai. These are like precision medicine models that have been created. If you're passionate about it, check them out. I believe Mirai is for mammograms and how they can predict disease onset. So it's pretty amazing. I feel like digital health is something that I'm really passionate about, and I always love it if I meet a like-minded individual. I'm all about like data and AI, and like I said, very specific applications of AI. So if that's something that excites you, I think that's definitely the line you should pursue, and don't ever let anything stop you from um, like pursuing what you want to achieve in life. Uh, if it's like lack of experience, if it's like anything at all, there always way to overcome that and compensate for the deficiencies. So don't let anything stop you.
Alright. Thank you so much, Dr. Feham. As for the rest of the participants, we have about 10 minutes left. So you guys can take a little bit of a break before we have our next session with Dr. Anusha Sultan. And Dr. Feham, again, thank you so much for joining us. It was a pleasure having you. And, we'd love to have you again at an APDSA platform. Thank you.
Thank you for having me. I hope you guys enjoyed it.
Yeah, I did. I enjoyed the jokes, and somehow you were strangely on point when you said I only need one Panadol, because that was very true. So, yeah, yeah,
Just
it was
was on
very
example.
right. Right. Thank
Alright.
you.
Thank
All
you.
right,
Feel
thank
free to
you.
reach out to me on LinkedIn if you guys have any questions.
I'll share your profile with all of the participants in our group chat, so they can definitely reach out to you there.
Perfect. Sounds good. All right. Goodbye, everyone.
Bye.